Patellar fractures with sleeve avulsion. Definition: patellar sleeve fractures represent chondral or osteochondral avulsion injury at the inferior pole of the patella.
In today's video, we want to briefly go over patellar fractures. These are fractures of the patella or the kneecap, and they can run the gamut from severe to mild. They account for patellar
Clinical case. A 9-year-old girl presented with knee pain and inability to extend her leg after landing on her flexed right knee while jumping on a trampoline. Physical examination revealed superior displacement of the patella, and a radiograph showed a fracture of the patella and the inferior pole. Of the patellar sleeve occur when a sleeve of periosteum is pulled off the patella. These fractures occur almost exclusively in children before the patella fully ossifies, and usually occur in response to the pressure of a force load on a flexed knee. The majority involve the inferior patellar pole. The fracture may be difficult to see on a radiograph, especially when the fragment of avulsed bone is small or absent. Diagnosis. In this patient, the diagnosis was confirmed on the day of injury during open reduction and internal fixation.
These are plain x-rays of the knee in a patient with trauma and knee pain. And on the lateral view of the knee, it looks pretty normal. We don't see any evidence of a joint effusion, or we don't see any evidence of a fracture. But on the sunrise view of the patella, you can nicely see that there's a comminuted fracture of the patella. So the sunrise view is often used if you're thinking there's injury to the patella, because it's really a focused view of the patella. On the lateral view, you're not able to see that fracture.
My name is Alex, and I'm making this video to talk about fractured patellas. There's not much information on YouTube about this, so I thought I'd make this video to spread the word about what to expect and maybe give you some tips too. So 4 months ago, I fractured my left patella. It was a transverse fracture. It was displaced, so I need to have surgery to screw and wire it back together. And I tripped on my driveway. I don't have a good story, sorry. Hopefully yours is better. And it was a pretty devastating injury, and I want to tell you about my road to recovery, and I want to give you some tips. So, first of all, I had a surgery, had a real good surgeon here in Reno, and he screwed me back together just fine. The surgery, I had a femoral nerve block, which worked really well until it wore off 24 hours later, and when it did, the pain hit me like a ton of bricks. So one tip I want to give is be sure you take your narcotic pain meds ahead of time before the nerve block wears off, because if you don't and you let the pain get ahead of the pain meds like I did, it was pretty bad, and I couldn't sleep, and I had to take kind of a 1.5 times dose of my oxycodone to kind of get ahead of it, just so I could sleep. With narcotic pain meds comes constipation. So what I used is this Miralax, and my wife would make me a green smoothie every day and put this Miralax in it, and that worked fine. I didn't have any problems when she did that. One tip I want to give you is don't use frozen peas like I did when the doctor says to ice your knee 20 minutes out of every hour. Just buy the right tool for the job. This is a Chattanooga cold pack. I got it on eBay for about 20 bucks, and it's totally worth it. It's great. You're going to be using it for the next couple of months, so just buy it. There's no comparison between a real ice pack and a bag of frozen peas, I found out. And that could have been some of my complications.
Conclusion. Patellar fractures in children are rare. but when present, affect patients younger than 16 years old. It happens because patella is more flexible during childhood and is less subject to impact and tension forces during quadriceps contraction, being also involved by a large cartilage layer. Those fractures can be caused by direct trauma, excessive contraction of the extensor mechanism, or by both. The major difficulty regarding patellar fractures in children is the diagnosis. Congenital abnormalities may be confused with fractures, and the size of the fragments, particularly in sleeve-type fractures, may be underestimated in children due to the partially cartilaginous nature of the patella. Thank you.